Hi, I am Dr. Gerald Gorman. I am the Chief of Emergency Medicine here at Niagara Falls Memorial Medical Center. We're in some kind of confusing and chaotic times, and probably anyone who's presented to the emergency department recently notices the changes that we've had to do in terms of our processes when you present to the emergency department. So we wanted to just educate the community and let you know this is kind of a new ground for us as well, and we're learning as well. But we want you to kind of know what to expect when you're presenting to the emergency department. As you walk in, I'm sure you've noticed kind of the new triage area, and I'll take people through kind of a couple of examples of what would happen and what we are seeing kind of on a day-to-day basis, just so you have some expectations of what's going on. Probably one of the easier ones in terms of triage is those patients that are fairly sick, okay? So they'll come in through our entrance. There is going to be a triage nurse there, and you'll present with your complaint. If you're sick, and when I say sick, meaning that you'd have symptoms, we're just going to kind of go over COVID type symptoms now, since that's what we're really trying to educate everyone about. If you have a high fever, are breathing fast, meaning your respiratory rate is fast, having trouble catching your breath when you walk a short distance, your heart rate is high, your blood pressure is low, or your oxygen saturation is low, then what we're doing is putting a mask on those patients and bringing them back to a couple of negative pressure rooms that we have that we've kind of isolated and called our COVID patient rooms at this time. So that's one subset of patients that's pretty straightforward. Now those again are going to be maybe your sicker patients. If they have moderately stable vital signs, but they have what are called comorbidities, so they may have emphysema, heart disease, in the higher age group, they may end up going to those rooms as well. Now, probably what most people are concerned about, or what we may term the walking sick. So you may feel that you're a bit short of breath, you've got a cough, are concerned about COVID, understandably, with everything that's going on. For this subset of patients that present, now this is new and probably different from what everyone is used to. You're going to come and present, tell your complaints, and then we'll do a set of vital signs and an oxygen saturation. So you may feel short of breath, but say your respiratory rate is normal, your oxygen saturation is normal, heart rate and blood pressure okay, and you're considered stable. What we have been doing is putting a mask on those patients and putting them in a waiting area specifically designated for COVID type patients. Now this is different than probably what everyone in the community is used to, where usually they may go to one of our fast track beds, but we're trying to isolate people a bit so they're not coming back to the main emergency department and so forth. At that point, what we're doing is ordering a chest X-ray so that those patients can have a chest X-ray, make sure that they don't have any signs of pneumonia. And then the provider will see them. So again, it's fairly resource intensive. We do apologize. We used to really want to see everyone, especially these patients, real quick, but it gets tougher because we're trying to conserve resources of our PPE. So each time you have a patient interaction with someone who may have COVID, you have to change out. And we're trying to conserve that to have it just one patient encounter, whether it's the nurse and the doctor, the PA going in to see the patient together. So you don't want to keep on going in and out and burn through the PPE. That's another reason for our limited testing. In these stable patients, every time you do the nasal swab on them, it's what's called an aerosolized procedure. So it requires more PPE garb. And we really want to conserve that. So testing stable patients right now is just something we don't have the resources for. There's not, we have limited testing kits to begin with, limited PPE. So those stable patients, we're discharging them. We have a COVID sheet in terms of what to do, how to self-isolate, symptoms to expect, and we hand that to them upon discharge. So I know it's a different process for everyone when they're coming in. It's a bit confusing. This is new to us as well, so we had to revise and revamp a lot of what we're doing. But that's kind of the process and the rationale for putting people through this. And again, we know that it's different, and for the community, it may seem odd. But if you're going to the waiting room, at least initially, it means that thankfully your vital signs are stable. The unstable ones go back immediately. When you go to the waiting room COVID pod with your mask, waiting for the chest X-ray. After that's all done, then the provider typically will come in. So I know that's a little confusing, different than probably what everyone's used to, but that's the new process. So I hope that kind of clears up some confusion for the community, but those are the new things that have been instituted over the past 2 weeks, and it has been a process. Each one of these has probably been revealed in different stages. So every time, if you've come in at different times, it's been different. But that's what you can expect over the next few weeks, probably at least. Good, understandable.